the mysterious molecule of the century. This is the epithet that botulinum toxin earned from the global neurological community in the year 2000, precisely for the millennium-long history of battling it, and more recently, due to its effective use in treating various diseases. Clostridium botulinum is an anaerobic bacterium that produces heat-resistant spores. These heat-resistant spores germinate and produce a toxin known as botulinum neurotoxin. Botulism is a severe infectious disease characterized by peripheral muscle paralysis as well as autonomic disorders caused by impaired cholinergic transmission, which is triggered by botulinum neurotoxin. Today, medications based on botulinum toxin type A are among the leading treatments worldwide for various neurological, gynecological, and neurological disorders associated with impaired neuromuscular transmission. Hundreds of articles and scientific guidelines have been published that demonstrate the effectiveness and safety of this medication. And it should be noted that, of course, it is most often used in neurological practice, especially in children from the age of 2 for the treatment of conditions such as cerebral palsy. But neurology is not the only specialty where we use medications based on botulinum toxin type A. Of course, these drugs are also used in cosmetology, plastic surgery, gynecology, urology, inpatient rehabilitation, oncology, and even in dentistry, ophthalmology, and psychotherapy. A unique mechanism of action, localized effect, long-lasting results, and the absence of systemic side effects of this describes botulinum toxin type A. Botulinum toxin works by inhibiting acetylcholine at the neuromuscular junction, as a result of which there is a weakening of muscle contraction. But medications based on neurotoxin have several therapeutic effects. It's not just significant muscle relaxation, it's also a substantial reduction in pain within them. The classic muscle relaxing effect of botulinum toxin typically appears on the second or third day, reaching its peak on the 14th or 15th day after the procedure. But it should be noted that there are such cases when the effect occurs very quickly, on the second or third day, or is delayed until the third or fourth week. In cosmetic practice, injections of type A botulinum toxin are mainly used to correct expression lines in the upper third of the face, namely the horizontal forehead wrinkle, the horizontal and vertical wrinkles of the glabellar area, as well as the radial wrinkles at the lateral corner of the eye, the so-called crow's feet. In the middle and lower thirds of the face, as well as on the neck, type A botulinum toxin preparations are used much less frequently. Botulinum toxin preparations are also widely used in cosmetology to treat hyperhidrosis, that is, excessive localized sweating. They are used to treat hyperhidrosis of the palms, soles, and also the underarm areas. Like any medication, type A botulinum toxin preparations have their own contraindications. There aren't many, but they do exist. The first is individual intolerance to the components of the drug. The second is neurological diseases such as myasthenia, myasthenic syndromes, including Lambert-Eaton syndrome. Third are all diseases in the acute phase, as well as chronic diseases during exacerbation. Fourth is an infectious and/or inflammatory disease at the intended injection site. And fifth is a condition such as hemophilia, and of course pregnancy and breastfeeding are also contraindications. The use of botulinum toxin has revolutionized medical practice. Its use is effective, safe, and scientifically justified. Optimists associate aging with wisdom, while everyone else associates it with wrinkles. But it is worth mentioning and keeping in mind that today, aesthetic medicine has achieved remarkable results. Therefore, we can face old age not only wise, but also beautiful.